Our story begins in Wuhan, China, a city that until recently was relatively unknown on the global stage. Towering buildings, busy streets, and the Wuhan Institute of Virology, now infamous, nestled quietly in its industrial complex. In early December 2019, unspecific pneumonia cases linked to a seafood market surfaced. As Chinese scientists probed deeper, they discovered a new virus, one that would change the world. The novel coronavirus, SARS-CoV-2, was identified. Known for its crown-like spikes, it had the ability to jump from animals to humans, starting a chain reaction that led to a global pandemic. As the virus spread, so did speculation. Social media platforms became battlegrounds of theories and accusations. Was the virus naturally occurring, or was it something more sinister? Two prominent theories emerged, one suggesting natural transmission from a wet market, and the other hinting at an accidental release from the Wuhan Institute of Virology. Initially, pangolins were suspected carriers. Their meat is considered a delicacy, and their scales used in traditional medicine. But deeper studies suggested the virus's origins could be more complex. While the origins were debated, the virus wreaked havoc worldwide. Hospitals filled to capacity, and health systems strained under the weight of this unseen enemy. Amid the chaos, accusations flew across borders. Who was responsible? Many pointed fingers at China, suspecting secrecy and cover-ups. From Wuhan, the virus spread rapidly. International travel facilitated its journey, turning local outbreaks into a global crisis within weeks. Politics intertwined with public health responses. In the United States, every policy decision sparked fierce debate, often along partisan lines. Internationally, demands grew for an independent investigation into the virus's origins. Australia called for a probe, sparking diplomatic tensions with China. To combat the spread, countries implemented lockdown measures, bringing bustling metropolises to a grinding halt and spotlighting the virus's socio-economic impact. In laboratories around the world, scientists raced against time to understand the virus, develop tests, and ultimately find a vaccine. But amid scientific efforts, conspiracies flourished. Some claimed the virus was a bioweapon, while others accused pharmaceutical giants and governments of engineering the crisis. Public health figures like Dr. Anthony Fauci became household names. They navigated the delicate balance of providing information against a backdrop of uncertainty and fear. History, too, was revisited. Comparisons were drawn with past pandemics, like the Spanish flu, highlighting both advancements and persistent gaps in our preparedness. Public panic manifested in various ways. Early days saw stockpiling of essentials, leading to empty supermarket shelves and a newfound focus on supply chain resilience. Daily life transformed. Education moved online, workplaces went remote, and digital interaction became our new norm. Essential workers, from healthcare personnel to delivery drivers, became the backbone of society, risking their own health to keep the world moving. The race for a vaccine became humanity's beacon of hope. Global collaborations broke barriers, achieving in months what usually takes years. Vaccinations began, marking a turning point. Hesitancy, hope, and relief were evident as needles pierced arms around the globe. Governments debated and strategized on vaccine rollouts. Questions of equity, accessibility, and priority dominated these discussions. However, the virus was not static. Mutations and new variants emerged, challenging the progress made and reminding us of the virus's dynamic nature. And research continued into understanding the virus's transmission. Investigations revealed the intricacies of how and why it spread so effectively among humans. Persistent calls for transparency brought scrutiny upon China's early response and the role of institutions, like the World Health Organization, in managing the crisis. The World Health Organization found itself at the center of controversy. Accusations of early missteps and political pressures placed it under a global microscope. Whistleblowers emerged, revealing what they claimed to be hidden truths about the virus's origins, government responses, and corporate interests. Amid investigations, the Wuhan seafood market remained at the heart of suspicion. Many theories pointed to it as ground zero, yet questions lingered. As we inch towards normalcy, the true origins of COVID-19 remain partly shrouded in mystery. Was this crisis a natural calamity or human error? Perhaps the answers hold lessons pivotal to preventing the next pandemic. The story of COVID-19's origins is not just about where the virus came from, but what it revealed about our world.